Hello, my name is Dr. Rake, and today I saw patient Colin. So here's some background on Colin. He's a 16-year-old male with severe eczema. He has not been properly managing his condition. None of the creams he's been using has been working, so he has a variety of open wounds on his arms and on his legs. And he's complaining on severe pain on one of his cuts. So here you can see that there's severe redness and it's going up his leg, and the cut is on the actually other side. So when I saw Colin at first, I did trace, it's not in this picture, with a pen where it went all the way up and all the way on the other side, because by the end of the consultation, I wanted to see if it has spread past the lines, because that would mean definitely some hospitalization. So upon examination, he had some different signs and symptoms. So he's been complaining of chills, sweating, and pain, and the cut on his legs. So those are some symptoms. And once arrived, I examined him. His temperature was 104 degrees. That's definitely a sign, and it indicated a fever. His leg was had an open wound, and it was warm to the touch and quite swollen, another sign. Overall, this was quite concerning. So I had some initial thoughts. After the examination of the signs and symptoms, it was obvious that the tests were required. My initial thought was that it was cellulitis due to the history of eczema and the look of the open wound. So I decided to do 3 different tests to determine whether or not this was correct, even though I was fairly certain this was. So when testing for the illness, there was 3 different tests I was interested in. First, I wanted to do gram staining, and one of the most common bacteria that causes cellulitis is Staphylococcus aureus, which I will talk about in a little bit. And it's gram positive, which means it stains purple. So when I do this gram staining, I'll be able to see whether or not it is gram positive. And next I will do the negative staining, because Staphylococcus aureus is spherical in clusters of cocci, and that is another thing I can look for. I can see it'll be a black background with white clusters, and that will help confirm. And then finally, I'll do a blood agar plate streaking. So Staphylococcus aureus is beta hemolytic. So that'll be a different look on the plate. It'll have some little colonies that have rings around them, and it's more of a yellowish color. So if all of these come back with my findings, I can confirm that it is Staphylococcus aureus causing the cellulitis. So this is the gram staining, and as you can see, it is purple and it has clusters. So the gram staining resulted in the bacteria being stained purple. Staining purple represents, as I said before, a gram-positive bacteria. So the bacteria causing cellulitis is Staphylococcus aureus, gram-positive. So that's the first check mark on my list. The second is negative stainings. So as you can see, this was the results we got back. Clearly spherical colonies and clusters of cocci, which is great. So these help confirm that Colin has cellulitis. Staphylococcus has the same morphology and arrangement as the negative stain, further confirming my suspicions. And then finally, we did the blood agar streaking. So this is what we came back with, and as we can see, there's a halo around each of the colonies, resulting in a beta hemolytic colony, which is what Staphylococcus aureus is. So that solidified the fact that Colin has cellulitis. All 3 of my tests came back with the expected results, and now we can move on. So Staphylococcus aureus is an organism identified through the results of the 3 tests. So it's gram positive, stains purple, it's spherical and clusters of cocci, and then it is found in the normal human flora found in the skin, which is important for Colin to know because he has a lot of cuts on his skin and he needs to be very careful in the future. So, and another important thing is that Staphylococcus aureus can acquire resistance to antibiotics through the adapting of its metabolism. So this will allow for more growth despite antibiotics. So that's why cellulitis can be quite dangerous if we have, like, for instance, a methicillin resistance Staphylococcus aureus, and have these bacteria that don't respond well to antibiotics. So we need to figure out what's going on and get help pretty quickly so Colin doesn't have any severe problems. So what is cellulitis? It's a sometimes painful skin infection caused by a bacteria. The infection is usually hot to the touch and is swollen and red, exactly how Colin presented. It is most common on the lower legs, but can occur anywhere on the skin, really, especially with eczema because you get cuts all over your skin. It just happened to be on his leg. If untreated, it can be life-threatening. It can enter the muscles, it can enter the circulatory system. It can be very dangerous, but it is very common with 14 million cases a year, and not many of them are life-threatening because most people get help very quickly. Cellulitis is not affected by travel, which is just important to know that it doesn't matter where you are, you can get it wherever you are. So finally, we have treatments and recommendations. So at the end of all this testing, when I came back, it had spread past the Sharpie line I drew on his leg. So it is spreading throughout his body system. So, like it says here, cellulitis is not normally life-threatening, but it did continue to worsen even in the just couple of hours he was in the office. In Colin's case, he does have a fever, which is another one of the major symptoms. That's something else that it is getting worse. And major symptoms. It is very swollen. You can see the fingerprint when you press into his leg, and it's very, very hot to the touch. So I'm going to recommend he goes to the hospital for IV antibiotics. The difference between IV antibiotics and oral antibiotics is that the IV antibiotics go straight into the bloodstream, so it can try to kill the bacteria that is in there very, very fast, and we can see whether or not it is resistant to antibiotics quicker than if he was just taking an oral antibiotic. So it will make sure the infection is taken care of quickly, and it's better to be at the hospital when he has these major symptoms so that if anything did happen, if it entered the bloodstream and it was causing some major circulatory effects, he would be in a place that is more equipped to take care of him than if he was at home. So I'm going to recommend leg elevation. That helps the swelling, it helps tenderness, and resting for at least 2 days, and definitely no touching. It's very, when it's cellulitis with eczema, it can be very itchy because it's an open cut, and eczema causes your skin to be very itchy, but the more he touches it, the more it's going to get bothered and the longer it's going to take to heal. Then pain medication can be taken if necessary. So below is a link from the CDC to help Colin understand what he has and how to take care of the other cuts from his eczema. This website will be helpful because it shows Colin exactly what he needs. So cellulitis, all you need to know, the bacteria that causes it, how they get cellulitis, signs and symptoms, breaks in the skin. This is important because Colin has eczema. How it looks, he knows how it looks now, but antibiotics are needed, complications, but can be serious, just so he can know how to protect himself, good wound care. I think all of this is very important because he has eczema, so it's likely that it might happen again. So overall, I think Colin will be okay. He just needs to go to the hospital and get the help he needs.